Welcome back to On the Leading Edge, brought to you by Beaumont Hospitals. The subject of this program is the heart, and we are joined by Dr. Ilana Kutinsky. Dr. Kutinsky is a cardiac electrophysiologist at the Beaumont, with the Beaumont system. Your office is in Royal Oak, right?
Actually, my office is in Troy at Michigan Heart Group.
Okay, you're at Michigan Heart Group in Troy, and I guess the first thing we need to know is, what is an electrophysiologist?
So a cardiac electrophysiologist is a cardiologist. So I received training in general cardiology first, and then extra training in electrophysiology, which is heart rhythm disorders.
Okay, the physiology being the actual working of how the muscle expands, contracts, or whatever, what electric impulses make it do that.
Exactly. So what we do is, but we're more very specific on the electricity. So if your heart goes too fast, we slow it down. If your heart goes too slow, we speed it up. So we put in pacemakers. We treat patients who have had sudden cardiac death. We take care of any sort of rhythm-related disorders.
Okay, now one of my physician friends, he's a surgeon, keeled over in his waiting room in front of his patients, and I didn't know anything about this. He called me a year later. I was trying to find him. I had no idea what had happened to him, and he said, it was an arrhythmia problem. I've changed my diet. I've got myself back in shape, and it's not going to happen again. And I thought, the guy passes out, and with diet and certain other things, he's okay now? Is that possible?
You know, it all depends on why they passed out. So the most common reason people pass out is actually not necessarily an arrhythmia, so to speak. It's more that the blood pressure precipitously drops and the heart rate doesn't necessarily pick up. And so that can be treated with diet maneuvers and other things, non-pharmacologic. In patients who have arrhythmias, usually we don't get away with treating them just with diet.
So there's something's
missing in that picture.
Okay, and you can replace that, though.
Yeah, absolutely.
Tell us about the commonality of rhythm problems. Is this something that's increasing? You obviously specialized in it. Is this something that's increasing in the general population?
Yeah, atrial fibrillation, which is the most common reason people present to the emergency room for arrhythmias, is increasing as the age of our general population increases. So currently, atrial fibrillation, there's about 300 to 400,000 new cases a year, and it accounts for 1% of the overall population in the United States. And as people age, it becomes more and more common. So as the population ages, it's becoming more and more frequent.
So all right, they age, and it's getting more common because of the age of the population. Is there something in my motor system here that's going to kind of run down like a used car? Is that what we're talking about?
It's a really good question. I think in people who have high blood pressure, if their blood pressure is not controlled, in people who have sleep apnea and their sleep apnea is not controlled, puts a lot of pressure on the heart. And the way I kind of describe it is it stretches the top part of the heart, putting you at higher risk for some of these arrhythmias. And so, yeah, as you age, there are there's changes in your heart as it ages that put you at higher risk for atrial fibrillation.
You mentioned high blood pressure, and this interests me because I have it, and it's medicated down to 120 over 72, 75. I'm usually pretty happy with that. But there are certain people who say, well, you can't keep taking that stuff forever. It's going to damage you. Talk to me.
It'll save you. Okay. I don't think it'll damage you. I think that we know for sure that high blood pressure is what we call a silent killer. It's not something that you feel on a day-to-day basis. But over years of untreated high blood pressure, people are very high risk for stroke, very high risk for a heart attack, high risk for a lot of other problems, kidney disease. And so it's something that's really, really important to treat.
What is your success rate, if you will, at Beaumont in treating problems of arrhythmia in patients?
Well, I like to think that we're really successful. I think we have a very comprehensive arrhythmia program. There's actually several of us that have the same position as me that work with arrhythmias. So we have a whole heart rhythm center, and we have an atrial fibrillation center where we treat only patients with atrial fibrillation.
Okay, now what's that?
Atrial fibrillation is a very hot topic these days just because it's so common. It is an irregular rhythm in the top part of the heart, and the top part of the heart goes very, very chaotically, probably about 400 beats a minute, and is filtered into the bottom part of the heart. So you're not actually feeling 400 beats a minute. You might be feeling 120, 150 beats a minute. But the problem is in the top part of the heart. And with atrial fibrillation, the top part of the heart doesn't work. because it's kind of wiggling almost like a ball of worms, because it's going so fast it can't squeeze effectively, and so blood can clot in the top part of the heart and it can cause a stroke. And it's actually the cause of probably 35% of all strokes in the United States is atrial fibrillation. So it's a super important problem. And that's kind of important part of it, but the other important part is that it really plagues the people who have it. So it really can cause a lot of problems with people's lives.
Can I tell if I've got it?
Some people can, and some people can't. So if you have it, some people say that it causes them to have they're very fatigued. They can feel racing, irregular heartbeats. It can sometimes interfere with their sleep patterns. They are short of breath. They can't do things that they want to do. And then there are other people, the lucky ones, who don't have any symptoms at all. It's found incidentally with a routine examination.
Okay, we're talking with Dr. Ilana Kutinsky. She is a cardiac electrophysiologist at Beaumont Hospitals here on the leading edge. The basketball player who recently keeled over in a basketball game, could he have been diagnosed had they known what they were looking for? Yes,
and it's just devastating. I was talking to one of my patients this morning about it, and it's heartbreaking. We've been at Beaumont, we have a very aggressive screening program for athletes, and we've screened over 5,000 high school kids. And that's what needs to happen. I think there are two things that could have happened there. If he had been screened appropriately, if he had gotten an EKG and an echocardiogram, he would have been caught. And then the other thing is that I think that if they had, I don't know if they had a defibrillator at his school. All high schools should have.
They did.
Defibrillate. And did they attempt to defibrillate him?
Evidently not.
I mean, that is crazy, for everyone.
What is a defibrillator? What does it do?
A defibrillator...
And you're going to have to do that in a very quick explanation.
Okay, a defibrillator is a way to shock the heart, to reset the heart. And when somebody has a fatal arrhythmia, it's the only thing that will save your life.
Well, that pretty much wraps it up. Now, why should I, and I have to get this in because I want to, choose Beaumont if I even have a suspicion that I have something wrong with my heart? My general practitioner tells me, you've got a problem. Right. We need to have it looked at. Why should I pick Beaumont?
Yeah, I mean, I think that we have a really comprehensive system. We really specialize in kind of individual care. I work closely with the surgeons and the electrophysiologists and the general cardiologists. We all work really closely together to give patients comprehensive kind of options. And so if you have an arrhythmia problem, we have more than one way of getting rid of it.
Well, that's good to hear. I understand you're doing some work in Nicaragua. I hate to cut it short. Can you give us a little overview of what's going on there?
There are no cardiac electrophysiologists in Nicaragua, not one. And so over the last 8 years, we have been going down about once a year to treat patients, mostly kids, who are on life-threatening medications to treat their arrhythmias. And we treat them with radiofrequency ablation, which is a procedure to cure their arrhythmias so that they don't have to take the medications.
Wow. Well, you're to be congratulated on doing that work, too. So many doctors do that kind of thing, and it's refreshing to see. Dr. Ilana Kutinsky, thank you for being with us. This has been On the Leading Edge, brought to you by Beaumont Hospitals. I'm John McCullough. Do you have a Beaumont doctor?